Tuberculosis is a highly contagious communicable disease claiming lives of millions over the years. Global TB reports of 2020 indicated that 10 million people fell ill with tuberculosis and 1.4 million people died of the illness between year 2000 to 2019 globally. Nigeria is ranked 6th among the highest tuberculosis-burdened countries in the world and first in Africa, with Kano among the leading states in the country. As the world celebrates the World Tuberculosis Day, Sefianu, aged 37, who was diagnosed with tuberculosis late February, said he received the news with shock because no one in his family has ever come in contact with the disease.
Kaddara ce take faruwa ga mutum domin gaba ɗaya daga ainihin samuna da wannan matsala zuwa a bayyana min cewa na kama da ita ɗin gaba ɗaya bai wuce wata ɗaya ba ta ma sanyi da na yi amfani da shi to ni nake tunanin kamar shi zai iya haifar min da wannan matsala.
Rama Salisu, who is still undergoing treatment, said although the treatment for tuberculosis is free, the stigma associated with the illness is unbearable.
Ko abinci na ci na rage ba a ci, kuma ko kai na bada an sha gaya mun yadda wa ake ba amfani da shi. Da mutanen da suke gudun ka ana cewa wani ciwo zaka goga mutane ma sun ce kanjamau gare ka. Amma da alhamdulillah wasu sa'in baka gane kana da ciwon sai in ka zo asibiti.
A 23-year-old Umar said tuberculosis is curable as he was once a patient too.
A gaskiya lokacin da aka gaya mun ba ni kaɗai ba ma, na jikina ma sun yi fargaba domin mai cuta ce wacce ake ganin kamar ba za a warke ba ga mu kenan wanda muke ganin bamu da ilimin sa, amma me alhamdulillah yanzu daga baya ana shan magunguna a hankali ciwo yana sauka yanzu komai ya zama mun normal, na dawo lafiya ta kalau. A gaskiya magani free ne aka ba mu shi.
Dr. Mukhtar Gadanya, an associate professor at Bayero University Kano and a consultant public health physician at Aminu Kano Teaching Hospital, said smoking and working in an area with lots of fumes or silica can increase one's risk of contacting tuberculosis.
What causes tuberculosis is an infection by a mycobacteria. It's a class of bacteria called mycobacteria, and there are majorly two types of this bacteria that causes tuberculosis. There is one called Mycobacterium tuberculosis, which is commonly acquired through inhalation, and there is another one called Mycobacterium bovis, which is usually acquired by drinking unpasteurized milk. So if, for example, you smoke and the smoking has damaged your lungs regarding their quality, regarding their immune defense, so when you come in contact with the bacteria, you are more likely than someone who doesn't smoke to acquire the infection. And not only for smoking, if you are engaged in an occupation which can damage your lung, for example, we know in Makoda, in Kano State, there are people who are into cutting, grinding stones. So they have excessive amount of sand, silica in their lungs. So when they come in contact with tuberculosis infections, they are more likely to acquire it. And not only people who smoke, who are at higher risk, or people who engage in occupations which can damage the lung, people too who have problems with their immunity. For example, people who are diabetic, people who are pre-diabetic. It's not only diabetes alone. There is a condition called pre-diabetes, which is sort of a watershed between not having diabetes and then having diabetes, and people with HIV. HIV and tuberculosis, they often come hand in hand. So people are right to say smoking can give you tuberculosis, but it does that not directly, but by making your lungs more susceptible to infection when you come in contact with it. just like HIV does, just like occupational exposures, which are dusty to do. So tuberculosis comes with a number of signs and symptoms. In a lot of people, you will see, depending on where the tuberculosis is affecting. In the hospital, we know there are broadly two categories of tuberculosis. There are the pulmonary tuberculosis, which affects the lungs, and there are non-pulmonary or extrapulmonary tuberculosis, which affects other body parts which are not lungs. So when you have the one affecting the lungs, you're likely going to come with weight loss, cough, and the cough may come with bringing out blood in the sputum. And like I said, weight loss, fever. The fever is not a constant fever. It's usually a fever at night, which comes with drenching sweat. So you wake up at night, you feel that you are drenched in your sweat. So people shouldn't mistake it with when the temperature is very hot. To prevent someone from acquiring an infection, there are general measures that need to be taken. Avoidance of risk factors like smoking, like excessive exposure to dust, excessive exposure to smoke, which damages the lung, and additionally they need to have good nutrition. Increasingly, science and evidences are showing vitamin D deficiency is associated with higher risks of tuberculosis accusation.
Kano State Program Manager for Tuberculosis, Dr. Ibrahim Aliyu Umar, said that partnerships has been made with organizations at different levels to bring an end to the spread of the infection. Even with the COVID-19 outbreak, lots of projects are ongoing to bring an end to the deadly tuberculosis.
Our treatment centers, we had less than 1,000. Speak, we have 711 before the COVID-19. But I'm speaking with you with the expansion, support from the government and partners, as well as other institutions. We expanded to over 1,000 facilities in Kano, giving TB services in the state. These are in addition to other collaborative services, as well as even the release of the state counterpart supporting TB activities in the state. In addition to our healthcare service provision, our community activity, we are doing a lot of community services through TB program. We are going to house, asking people about symptoms of TB, and then going to a lot of engagement to the private sector, because a lot of personnel in Kano State goes to the private sector, private hospitals, private laboratories, standalone labs and clinics for various illnesses, including symptoms of TB, which is cough. But with our engagement with these institutions, we have been able to expand our TB services in the state. And even when the COVID-19 came, and it was obvious that COVID-19 has become a global pandemic and is impacting negatively on a lot of things in our life, in the whole world. We in the TB program, through the ministry's leadership and support, had to sit down with all stakeholders and institutions supporting TB program in the state to look at what do you do to ensure what we call carry out sustained TB services in the midst of COVID-19 in Kano State. And incidentally, some of the symptoms of tuberculosis also are symptoms in COVID-19. So with that makes our integration much easier, and that makes our screening and service provision to our populace much easier, because whatever symptoms somebody has, if that person comes to the hospital, healthcare workers provide screening for this personnel. And where it is suspected that TB is there, screening for TB is there free of charge. Where it is suspected that COVID-19, where we have the patients presenting with these symptoms, services are provided and it's integrated, so it's much easier for us to provide screening services for all the patients, but for TB or for COVID-19. And then in terms of care, we know the line of care are different, but these are healthcare system, and we're working on one healthcare system in Kano and Nigeria, where whatever illness somebody has, care is provided based on the needed services for the individual.
World Tuberculosis Day is celebrated to raise public awareness about the health, social, and economic consequences of tuberculosis and to step up efforts to bring an end to the global tuberculosis epidemic. The theme for this year's World Tuberculosis Day is "The Clock is Ticking." Mariam Muhammad Bawa, Solis Base TV.